Hello and welcome to CB Insider's virtual fireside chat with Zahid Salman. Zahid is the president and chief executive officer of GreenShield, an integrated health services organization serving over 6 million Canadians, and the first in Canada to be both a payer and a provider. Uniquely structured as a non for profit social enterprise, GreenShield is passionate about championing better health for all. Welcome, Zahid. Thank you so much for joining us today.
Yeah, thank you for having me.
Great. So now I'd like to introduce our host, Jason Maganoy, publisher of Canadian Business. Thank you both again, and take it away, Jason.
Thank you for the introduction, Chantal. So I'm very excited to chat with you because we're going to be talking about it sounds like we're going to be talking about a lot of future of healthcare stuff. But my first question for these is always the same. How are you? And how have you been holding up as we emerge from the pandemic?
Yeah, no, thanks for asking, Jason. I think now that we're starting to emerge, as you say, from the pandemic, I think I've really realized what we missed, during almost 3 years of lockdown. So it's been great to start traveling again, both personally and for business, and see people in person as people start to come back to the office a few days a week. So it's been really refreshing because I realize now how much I miss some of that in-person interaction.
And that's the thing too. Like I've literally just been seeing people. Like we've had team members we're meeting for the first time right now. Right. So it's actually incredible to just go, oh, so I guess we're going to be collaborating. So that's fantastic.
Exactly. Seeing people below the neck, right? This is a bit awesome people.
So I mean, I'd love to hear more about your career. So tell us about your career and what brought you to GreenShield.
Yeah, so I'm a pension actuary by background. So in university, I studied actuarial science at Western. And that took me into the broader HR and benefits consulting industry. So the vast majority of my career was there serving clients around their pensions, benefits, and broader HR programs. And then in 2018, there was this great opportunity to join GreenShield in a somewhat new industry, but very, very adjacent to where I'd been my whole career. So it's my first time on the insurance side, and I've been really, really enjoying it. Also, what drew me to GreenShield was the whole not-for-profit social enterprise piece, which I don't think I fully understood until I joined the company, right? But it's so rewarding, having worked at publicly traded companies my whole career, to now be in an organization where there are no shareholders, and all that we do with the earnings that our business generates is help improve the health and well-being of Canadians. So really giving back to society and running social impact programs is really why we exist, and it's been really fulfilling.
So, I mean, obviously GreenShield it's a big part of the healthcare system. Like the question I have is, healthcare seems really complex. Like it's a very complex system. Tell us about the need to simplify healthcare. Why is that important? And how does an organization like GreenShield make a difference?
Yeah, so maybe I can go back in time, just give you a bit of context, and I'll answer the question directly. So simplifying healthcare, and more importantly, providing access to healthcare has really been in GreenShield's DNA since our founding. So we were actually founded in 1957 by a pharmacist in Windsor named William Wilkinson. And it's a really neat story. So the event that led him to create what eventually became GreenShield happened when a young mother walked into his pharmacy in Windsor, and she had 2 prescriptions to fill, one for herself and one for her young daughter, but she could only afford one. So this was before Medicare or anything like that, right? This is 1957.
Wow.
And she ended up going without the medication she needed so that her daughter wouldn't have to. So this really impacted William, the whole societal issue of affordable access to prescription drugs. So he ended up doing 2 things. First, he created North America's first prepaid drug plan so that people had prepaid funding to access prescription drugs when they themselves couldn't afford them. And that's actually a benefit design that exists to this very day. So the vast majority of Canadians who have employer-sponsored benefits enjoy this prepaid drug plan design as part of that plan. Then the other thing he did was establish GreenShield at that moment as a not-for-profit social enterprise, whose main objective was to use the earnings this business generated to improve the health and well-being of Canadians, like I was saying earlier. So that's remained core to us for well over 65 years now, right? Like we exist to help improve access to healthcare. So when you ask the question, I just wanted to give you the context that we always think about that. Everything that we've done as a business, as an employer, has been around that. So wow. As we look at what's happening in healthcare right now, as you say, we should, as Canadians, be very proud of the healthcare system we have, but there's no doubt that it's facing a whole bunch of challenges today. So you've got 1 in 5 Canadians who don't have a family doctor. Those who do have a family doctor, I think it's almost a third of them wait more than a week to see the doctor when they need to. Mental health claims increased by 75% during the pandemic, and you've got 40% of Canadians still saying that they wish they had easier access to mental health care. So all these things are sort of what we think, we can also help with as a company and as a not-for-profit organization. So we often refer to our founding story as William Wilkinson founding a better way. And we're now looking for our next better way. And that next better way really is, how do we take our business, which has been providing health insurance and benefits coverage to Canadians, and how do we better integrate that with delivery of care in a way that improves access to that care, and really bring the provider part of providing healthcare services together with the payer part that we've been doing for 65 years, where we provide insurance and pay claims, and bring them together in a way that improves access and also improves the patient experience to help support the healthcare system in the country.
Wow. I mean, you just touched upon a time that I never even thought existed, which is like before Medicare, before public health. Incredible. Yeah. Which takes us to now. I mean, our big cover feature in Canadian business was about virtual health, digital health. So how do you see virtual clinics, digital health transforming the healthcare landscape in Canada, especially when it comes to things like accessibility and affordability for patients?
Yeah, so I think we're at this wonderful inflection point right now coming out of the pandemic, where there's much more appetite from stakeholders across the spectrum for change. And I think that will also lead to greater private sector and public sector collaboration, right? When you think about healthcare, we think about that's the domain of the public sector. But ever since Medicare was founded, private sector has actually been supporting healthcare as well. So today, 30% of coverage for healthcare benefits is done by the private sector. And most people don't even realize that, right? Wow. You think of things like prescription drugs, the dentist, many types of mental health care, massage, all those are benefits not covered by the Canada Health Act. So there's this whole private sector of insurance companies that's been serving that. And we do it, we compete against each other, so that pushes each of us to innovate, to use technology and all that. So I think we're at this wonderful point now where there's a lot of conversations happening about how can the private sector help deliver publicly funded healthcare. So not in a way that people have to pay out of pocket, because we rightly look at healthcare as universal right in Canada, but how can we use some of our tools, our technology, our innovations to deliver under public healthcare some of these services? So a great example would be a GreenShield. We've been doing a lot around mental health care the last several years, and have acquired some really neat leading edge capabilities. So we've actually been hired by 2 provincial governments who are using our mental health services and are delivering them to the citizens in those provinces. So it's still fully covered by provincial healthcare in those provinces, but it's being delivered by us in the private sector. So I think, that is a conversation that needs to happen. I think we at GreenShield, especially the not-for-profit, can really hopefully help enable a more effective publicly funded healthcare system.
Takes me to my next question, was what is GreenShield Plus? Yes. And how does it work? And the second part of that question is, how is the GreenShield Plus app evolving and shaking up the industry?
Yeah, no, for sure. So we describe ourselves at GreenShield as the country's first payer and provider. So let me just set the context of what that means. And the GreenShield Plus app really brings that to life, right? So as a payer, all health insurance companies would be payers. We've been one for 65 years. That means we provide insurance, we administer benefits, and we pay claims. The claims we pay are for healthcare providers that are providing services covered by an employer-sponsored benefit plans. And typically the providers are totally separate from the insurance company. What we've done strategically the last couple of years is we've pivoted our business model so that we're also now a healthcare provider. And so we're providing services like mental health care, providing access to telemedicine services, and also to digital pharmacy, because we feel that those are 3 areas of significant need for Canadians, and that we can add value, A, by connecting those health services, and more importantly, connecting them back into our benefits plans and how we manage those plans. So let me tell you in a story then what GreenShield Plus, the app, would do, because it's the technology that would bring this integration to life. So imagine And so I talked earlier about a founding story about the young mother walking into our founder's pharmacy. So imagine now a working mother today who wakes up early one morning, ready to go to work, but is just not feeling well enough. She's got this terrible headache, but she's got kids at home, and she's one of the 5 Canadians who don't have a family doctor. So she can't really go into a clinic. So what does she do? Well, she can actually pick up her GreenShield app, and through the app, she can actually access telemedicine services, which will get her in front of a doctor, almost immediately. And that doctor, because the data is connected to our administration platforms, will know who the person is and will greet her by name. So the doctor, imagine, can do a couple of things. So the first thing the doctor can do is prescribe some medication for the pain she's experiencing. And because the app also has a digital pharmacy connected to it, the medication gets delivered to her house that day, right? But then the doctor says, really, well, what's the root cause of this headache you're experiencing? And he suggests the root cause might be anxiety and suggests she speak to a counselor. So that's great. She can hang up with the doctor, go back to the app, and dial up a counselor and get in front of a counselor almost immediately as well, right? So that counselor can provide some therapy and some advice on how to manage anxiety. And let's say that counselor says, there's some tools that you have that longer term you can build some resilience to get over anxiety in the longer term. And there's a really cool tool out there these days called internet delivered cognitive behavioral therapy. So it's a learning module that you take to build resilience. Well, guess what? That's built into the GreenShield Plus app too. So you can access it on the app and take the modules. They're therapist guided, and take them at your own convenience over the next several months, right? So all that is done from the comfort of your home. You haven't had to struggle to find, how do I access a doctor or a counselor? How do I get to the pharmacy? It's all taken care. And the best thing is that all these services are covered by your benefits plan, but it's always a challenge, right? When you think about your benefits plan, you got to file claims and do all this paperwork. All that's integrated into our claims platform. So all that's done behind the scenes for you, taking a lot of that paperwork worry away. So that is what the app is meant to do, right? So I just described to you sort of example, the full vision, and we'll continue to develop it so that this whole story I just shared with you within the next year or two will be fully possible on that app.
So that's an incredible juxtaposition between that first story we talked about
right.
and the story you just described. But the story you just described is not the story right now. That seems like it's a big jump from what our healthcare experience is. How will you tell this story? How will you onboard people into such, it seems like way easier, way more seamless experience, but so different than what we're already doing? How do you get people to make that leap?
Yeah, so I think we're talking to our clients. We're going to be doing a rebrand of your organization. As part of that, we'll be telling the story of, what can a payer and a provider business model do, and how will the GreenShield Plus app enable that. Now, it's important to recognize as well that, the app and what I've described can really help handle simple or moderate health issues. There's a whole number of health issues where you need in-person care that our app isn't going to solve. But hopefully what our app will do is it'll take capacity, avoid capacity being used in hospitals, in doctors' clinics, and actually redirect them so that those forums can really take the more complex health issues. So hopefully not only are we helping the individuals with these mild to moderate issues, but we're enabling greater capacity for the more complex ones. So that's what I meant earlier about what we're trying to do is help enable and support a more effective Canadian public health system by managing through employer benefits that have been around for many, many years, some of these more simple and moderate issues in a more connected way.
Wow. And there's one user story that we opened with, then you just described a very exciting one. Speaking of things continually being shaken up, obviously it's in the news, AI is big. What role do you envision for AI and other emerging technologies in the delivery of healthcare services, and as well as the impact for patient outcomes?
Yeah, great question. So, when we think about how AI might impact the healthcare space, I think we're both excited and nervous, right? So I think there's definite risks associated with AI, whether that's around, privacy or equity or bias, things like that. So we absolutely have to be solving, not just in healthcare, but more broadly, to make sure that AI is actually helping us achieve the outcomes we want as opposed to unintended consequences. So let's just assume that we can manage that, and there's many strong minds focus on that. But then look at the potential that AI has in this space, right? What we want to do is we want to create a very specific set of value drivers through what we're doing, right? And we've been very deliberate about those. So what we're trying to drive for individuals using our services and the GreenShield Plus app would be access, so faster access to healthcare services. We want to create convenience. So that whole story I told you about accessing all these services from your home and having all the paperwork for your benefits claim done for you, that's the convenience part. We want to create integration. So we want these services to talk to each other, not just the healthcare service, but also talk to the whole claims reimbursement process. And then we want to drive better health outcomes through the services that we're delivering and when we're delivering them. And that last part in particular is where I think AI can play a huge role, all right? It can really help better inform Canadian consumers so that when they're patients of these services, they're better informed as to what their options are, what types of care they can receive, even how to navigate across multiple different healthcare providers. I think AI can enable a much better experience around that today, in the future than is available today. I think AI can support healthcare practitioners, so it's less about replacing them, but I think this will take away a lot of the administration. It'll give faster research and better inform their care plans so that they can deliver better care. I think that's one definite advantage to practitioners. And then finally, for the healthcare system as a whole, right? Hopefully this will lead to more informed, faster, potentially even more cost-effective care that will help the sustainability of our own healthcare system. So these are all potential benefits. We'll have to see.
I love everything you just said there, because that sounds very reasonable to me. But I mean, this idea of creating GreenShield Plus, even creating this new product in your organization, why did you do it? Like, how have digital health demands, like, how have they sparked the inspiration for creating this new platform?
Yeah, so we had this hypothesis before the pandemic around how we could find the next better way in terms of helping improve the health and well-being of Canadians, right? And we saw, some of these challenges in the healthcare system have been around for a while. We saw mental health incidents increasing even before the pandemic. We saw the fragmented care between different providers, and especially when you try and get reimbursed through your benefit plan, where some services aren't covered through provincial healthcare, right? So all these things we're trying to say, well, how can we help and how can technology enable some of what we're doing? Then the pandemic hit, and then some of these hypotheses turned into secular trends, right? So we saw an incredible spike in the utilization of digital healthcare, where it was in the low teens before the pandemic for some types of healthcare services. We saw things like telemedicine spike to 70% utilization. We know through various surveys that 90% of Canadians have now either accessed digital healthcare or are open to doing so. We know that over 60% of Canadians wish they wouldn't have to repeat their health story every time they go to a different practitioner, and that they could get all their care in one place, sort of like an ecosystem. So these are all the things that have pushed, I think, some of this forward, not just for organizations like us, but other organizations as well. And expectations have changed too. So there's an incredible survey done during the pandemic as we're starting to emerge that showed that over 80% of Canadian workers were starting to expect that their employer would provide access to digital health solutions, right? So as more and more employers started to focus on health and well-being coming out of the pandemic, they needed to respond to that expectation from their employees. And many of them started to come to their health insurers to say, how can you help us meet this need for greater access? So all those things together are what drove us to that. But really, I'll go back to the story I mentioned in the beginning about us as a not-for-profit social enterprise. What really excited us about this business model was that this combination of payer and provider services allows us not only to help our paying customers, but more importantly, it allows us to help our local communities. And how might you ask? So in the past, the way GreenShield has always funded its social mission was we would use our excess earnings and contribute to other organizations who would deliver care in our local communities. And our focus for many years now has been mental health and oral health for that kind of care delivered to underserved populations in our local communities. So we're just a funder of some of these things. But now that we started to acquire these healthcare services, we can now actually use those services to deliver care directly to the local community. So no longer just a funder of the services to these populations, but also now a provider. So a great example is we have this program, it's called Room for Her. So one thing that we saw during the pandemic was that there was a disproportionate impact on women's mental health because the responsibility for things like childcare, elder care, etc., fell on women. Over 100,000 Canadian women left the workforce at the peak of the pandemic. So we thought about, well, what can we do to help their mental health? Recognizing, of course, that every Canadian's mental health was impacted by the pandemic, but there was this disproportionate impact on women. So what we did was we took our various mental health services, we offered them for free under this program called Room for Her to any Canadian woman over the age of 18. And this launched just over a year ago. And already we've helped 60,000 Canadian women access mental health supports at no charge. So it's incredible what we can do now with this offering that we have socially, not just in terms of serving our customers.
Wow. I mean, this huge innovation, it sounds like, is this idea of you're collapsing the value chain everywhere in terms of just getting everything closer. It is very innovative. It is very, very innovative. But I don't think of the insurance and benefits industry as being super innovative, as moving super quickly. Like I'm still getting checks. So it's like it's a bit where I go. So you obviously are taking a leadership role in all of this. Your innovation lens seems to be helping. Like you want to help, you want to make things better, you want to make things faster. So, but how do you see the industry as a whole? Like how do you see insurance and benefits industry as a whole growing to accommodate this demand for digital health services? Obviously, you're playing a leadership role in this, but how do you think that impact, your leadership role, is going to make an impact for the rest of the sector?
Yeah, I think the whole sector is facing the same headwinds and demands from our clients in terms of the broader set of services to provide to support better health and well-being. And I think you'll see the whole industry is going through a pretty significant digital transformation, because you're right. You know, whereas in the past we might have tried to build our own things, we just can't go at this pace and the scale that is needed to address some of the issues that we've been talking about. So in our case, for our digital transformation, our GreenShield Plus platform is actually built on technology developed by the likes of Google and Microsoft, right? So we're tapping into their scale, their pace, and their forward-looking capabilities to help accelerate the speed that we can go at. I think the speed that each insurer can go at will depend on their legacy platforms. We're in a pretty unique position in that we have just our one claims adjudication platform that we've developed in-house. And we're also our own pharmacy benefits manager. So many insurers, you know, the drug card that you have when you go into the pharmacy, many of those outsource those to other providers. So you've got to integrate with them. We're our own PBM and our own claim adjudicator. So because we only have the one platform to then integrate all these health services into, it's easier for us. And by having the support of some of these larger technology companies, we've been able to go a little bit faster. But for sure, this is an industry-wide issue. And I think the whole industry is thinking about what can we do, given we're already managing 30% of healthcare coverage. How can we better support the public healthcare system as we also support the needs of our clients? So it's definitely something that is talked about and is being actioned industry-wide. Absolutely. And we should definitely make sure you don't get checks for your reimbursement. We can get you automated payroll deposits or something like that, right? In your bank. That's something to help you out, man. No more checks.
that actually, like you touched upon it earlier, but you know, the way that you've been investing in underserved communities, for example, where healthcare access is an issue, you're demonstrating a very, very different model. How will your new structure, like how will it benefit underserved communities even more so?
Yeah, so one of the reasons, one of the strategic objectives that we have through this whole repositioning of the company, if you will, is around amplifying our social mission. So when we launch our new brand later this year, we're really going to amplify the social impact brand, actually have a name for it. We're going to brand it as GreenShield Cares. Because when I talk to our board of directors, our number one objective as an organization is the social impact. So we have this objective of investing $75 million through 2025, which is the period of our current strategic plan, to improve the lives of at least 1 million Canadians, right? So that's our number one objectives. And that Room for Her mental health program is one. I've talked about the number of Canadian women we've impacted since launching that. Another big one is on the oral health side. So I mentioned our two areas of focus are mental health and oral health. On the oral health side, we've already invested over $20 million in two things. One is research to demonstrate the importance of effective oral health on overall health. So we've actually engaged the University of Toronto, and are funding them to conduct independent arm's length research that demonstrates the importance of oral health and overall health. And the other thing that we're doing as part of that $20 million commitment we made thus far is we're running free dental clinics across the country focused on the working poor. So these are individuals who make income at a level too high to qualify for social assistance benefits for dental, but not enough where they're able to afford to go to a dentist, given that to pay for food, shelter, etc. Right? So we've been funding free dental services for them. So we're ecstatic to see this potential of having a dental program at the federal level that we filled in the gaps that we're helping fund right now. But that's another example. We wouldn't have the service capability or the funding capacity to do some of these things, to contribute that $75 million to improve the lives of 1 million Canadians, if we hadn't pivoted to this new business model where we brought on some of these new services. So that's really how it's helping us advance our social impact.
Wow. I mean, you touched upon the rebrand.
Yeah.
But it's obviously, it sounds like it's more than just a new look. It's not like you're just putting a new logo out there. You're completely changing how you're functioning as a business. Which takes me to my next question, which is this idea of it sounds like you're identifying technology. You're identifying partner. You're acquiring really interesting partners as well.
Yeah.
What other examples of technologies or advancements in healthcare are you looking at that you're going to double down on, that are going to continue to provide these innovative solutions for the healthcare challenges that we're facing today?
Yeah, no, that's a great question. So we've got sort of a longer term roadmap. Where we're at right now is really finding ways to effectively deliver care digitally. So I mentioned something earlier called internet delivered cognitive behavioral therapy. There's actually studies out there that proves the effectiveness of that modality of care. And then it's great to see that many physicians are supporting, for certain cases, the use of telemedicine, so remote or virtual physician visits. So understanding how can we deploy technology in a way that not just deliver those services, but more importantly, like I said, connects them, right? Because you can, if you go back to that desire by Canadians to not have to retell their story, to get access to everything at one place, I think using technology to create those integration points, using data in a way that with the appropriate privacy and consent protections, that we can create a bit of an individual health record, so that when you go to whatever practitioner it is for a given ailment at a given point in time, that practitioner has access to a broader set of issues to understand your health profile. And that's an issue in the public sector as well as the employee health record, but has it really been managed effectively from the private side in terms of benefit plans? So hopefully we'll bring that, which will provide more informed, holistic care. So those are some of the areas where we think technology can continue to advance. And the whole notion of health outcome, that's going to require effective use of analytics based on the various data sets that we can collect with the appropriate privacy and consent. So that's something that's not really prominent in Canada today. We don't really measure health outcomes. We don't reimburse for health outcomes. If you look at the States, they have a bit of a different model where they have been doing that, right? With a view to really, what are the outcomes we're trying to drive? And I think technology will be a good way to help us drive those improved health outcomes, to get people to think more about health outcomes versus just, time-based delivery of care.
So, we touched upon it, my check got lost in the mail. So my question is, why should business leaders choose GreenShield for their employee benefits program?
Yeah, so obviously, I guess I'm biased when I answer that question, right? But first of all, I think business leaders need to think about what employee value proposition are they starting to create, right? I mentioned some of the expectations that employees have around how the employer should help improve access to health services for them. As I said as well, many total rewards practitioners now are trying to embed more of a focus on health and well-being into their benefit plan. So I think first and foremost, it starts with an employer saying, what is my role in supporting the health and well-being of my employees, right? And is it just providing coverage for benefits, or is it also enabling better access for care? And I think those who see the value of doing the access piece, but in a way that's integrated with your benefits plan, I think that what we're building and what we're pivoting to from a business model perspective as both a payer and a provider, I think that can really add a lot of value. At this point, we're the only one in Canada who's both a payer and a provider. That for sure may change over time. The payer-provider model has been active in the US for a bit longer, but they have a very different healthcare system, obviously. But I think for now, we have a pretty unique value proposition, which will hopefully resonate with some employers whose objectives align with some of the capabilities. And the other part is over time, we often talk to our clients about, hey, we are a not-for-profit, so you have the comfort of knowing that any earnings that we generate are being used to improve health and well-being with a focus on mental and oral health in our local community. So it's been an interesting inflection point there as well. I think in the past, that was a nice to have. We would still be evaluated based on the strength of our service offering. And as long as that was on par or what they're looking for, then the not-for-profit piece was a nice to have. Now, some more progressive employers are actually using the fact that we're not-for-profit and can potentially partner with them on various community initiatives. They're using that as a decision driver when considering choosing an organization like that. So it's been neat to see that emerge in decision making.
Yeah, I mean the integration, the value proposition, the fact that you're a nonprofit, all of those things just make it a very attractive solution. And going back to that user story, that idea of it just sounds like having more access to healthcare allows you to use it more. It's very, very reinforcing, which obviously will drive better outcomes. You want people to continue to use healthcare so that they can be healthier. So, obviously
you raised a really good point there. Not to interrupt, but you raised a really good point. It's not just about accessing healthcare when you have an issue that needs to be solved, but accessing it from a preventative basis. So if you look at this generation, like my kids, they access mental health counselors from a preventative basis, right? It's almost like our generation, we started going to the gym to proactively manage our physical health, right? They have open conversations with counselors just to proactively manage their mental health, right? So some of the services that we can enable through our app can be used from a prevention perspective, not just I have an issue that I need help with perspective.
Yeah, and what I love about it too is just you're focusing on areas of need that the demand is really incredibly high. Like mental health is huge, especially now as we're emerging from the pandemic. Hybrid environments for work. It's a tough economy out there. Like all these things, the benefit that you're going to be able to offer and the access and speed at which people can be able to access the benefit is phenomenal. So,
and I want to touch on what you raised earlier, because you raised a really good point earlier that we didn't really get into is what we're doing controversial from the perspective of a universal healthcare.
Yes.
And from my perspective, it shouldn't be controversial at all, right? There's the two main hallmarks of our universal healthcare system, right? One is that no Canadian should be out of pocket for any essential healthcare services, and we're 110% aligned with that, right? And the other part is that delivery of the essential services should be managed by the public sector. What we're trying to say here is that we can help the public sector deliver these publicly funded services to Canadians more effectively using some of our innovations, using some of this emerging technologies. We're not in any way trying to compete or take away from the public healthcare system, nor are we trying to advocate that people should be paying out of pocket for any of these services, right? We really view our role, especially as a not-for-profit organization, to help enable a more sustainable healthcare system. So, that whenever I talk to people in government, that's something that we try and reinforce, is that we think our solution that we're building can actually help them.
And I think that's the thing, like even describing the user, like even describing the user story, it's very clear that it can help people. And what's amazing, and what I think when I asked that question, it literally was because of the fact that, like, we're talking about the insurance industry not innovating. Healthcare doesn't seem to innovate very much either. So it's like a thing where you're going, like, when you encounter a platform solution that really does take it to another level. It is a very, very, it's a very, very different value prop. It's disruptive. And I think when you start moving into that space, obviously it feels controversial, but it isn't. It's actually a really great way to add value to the ecosystem that we currently have. But what is next? What is next for you personally as we enter the spring?
Yeah, no, for sure. So I mean, for myself, I mean, we're very much focused on what we're trying to do with GreenShield, with this vision. We're still in the very early stages. So as the change is starting to manifest in the organization, we use this analogy of how change is hard at first, messy in the middle, but gorgeous at the end. So we're very much in that messy in the middle piece where we're trying to build these things, launch them. So I'm looking forward to that gorgeous at the end, as everything starts to come together and work the way we want it to work. And then for me personally, I'm just looking forward to telling the story around this, and hopefully really helping Canadians improve their health. I think not just me personally, but our whole organization would take a lot of satisfaction if we can do a little bit of that and do our part in improving health and well-being in the country.
Yeah, when you were moving into the sector,
yeah.
were you like, was that a prerequisite for you when you made the move? Like, I kind of have to go into a sector and have the ability to do interesting pivots and changes like this, or was that an important part for you?
It's a huge part, especially when you're changing industries, right? It's sort of like what's going to draw you to make that change. And like I said, there's this huge inflection point that we're at, because all these forces are coming together to say, okay, now's the time to rethink bigger and bolder. And GreenShield, the board, has been fantastic in terms of giving us as a management team the opportunity to think big and bold. And it's been great so far. The pandemic made it hard, let me tell you, right? Because the peak of the pandemic, you're not thinking about strategy, you're thinking about survival. Right. But then as things started to lift and we saw that the business was being pretty resilient, then we went from no acquisitions in the first 63 years of the company to 8 in 2 years to build out this model, right? So it's been fun. It's been a lot of work, but it's been rewarding so far. And I can't wait till this app is out in the market and people see it and can experience it. We'll see what they think.
I love that pivot from like sort of survival to strategy, and to get 8 acquisitions rolling in such a short amount of time is incredible. Zahid, thank you so much for this. This was a great chat and really great to learn. And I'm really happy that we had a chance to talk about this and we can share this with our readers. They can learn more about the great initiatives you have coming up. But thank you again for taking the time.
Yeah, thank you as well. This is a great discussion.